of the things that you were bringing up is people with mental health, and I wanted to explore this a little bit because this podcast is really about helping people to understand what yoga therapy is, how we differ from traditional, like say, psychotherapy, the Western medicine that's out there. Like, what makes us different from a physical therapist to a mental therapist? So, we do not diagnose, right?
Mhm.
So if somebody comes to you and says, I have a diagnosis, right? What are some of the things that you feel or have experienced that have differed from the Western medical system and what we provide and kind of like that integrative
Mm,
piece?
mm. That's such a beautiful question. But it also is so interesting to hear you say that because we are what I think and I see as yoga therapy, we do fill the gaps that might be missing in Western medicine. And I think that's the true beauty of it. But when it comes to looking at someone who maybe comes in with a diagnosis already, we take that as a piece of information, not that that diagnosis is the whole person. And I think that's what makes it very different. Yoga therapy as a whole is that we see a person as the whole person that they are. And maybe this diagnosis, it is contributing to a sense of discomfort and distress in their body. And we look at it in that's one part. It's not the whole story, right? It's like there is this environment that is the physical body, and for some reason they have this challenge that is in their life now, and that being like a diagnosis, which not saying that all diagnoses can be challenging, but sometimes a diagnosis can bring in a changed perspective of someone's just identity. And I think as a yoga therapist, it's our job to help someone see that they are not who this person's identity is not their diagnosis. A
Mhm.
diagnosis is a part of this person's story, but it's not the whole story. And that's something that we really work on as yoga therapists is helping people see that they can disentangle from this sense of feeling attached to maybe the less than perfect aspects of themselves so they can see that they are a whole person. While they may experience a challenging condition, they are not that condition. So to help them
Right.
reconnect to who they are, that sense of being that is not uh, changed by having a condition. It's that steadfast part of themselves, that aspect of their being that cannot be changed, even if they have a condition. So that's kind of where we get to. It's that more deeper aspect, if that makes sense.
Well, to me, it makes sense.
Yes.
And I will say that it was beautifully stated. So thank you for that.